name's Kevin Smith, and as Marc said, I attended a one-day seminar about 3 months ago on the recommendation of a friend of mine, Kristen. I knew nothing about what Marc was offering, just that she said I should do this, so I did. And after I sat down, I found out that the topic was the lymphatic system, and I said to myself, but I'm a chiropractor, what's this going to do for me? And some of the solutions provided were homeopathic in nature, and I said, I'm a chiropractor, what's this going to do for me? Oh, well, I already paid the admission fee, I may as well go for the ride. And it proved to be singly the most transformational thing I've done for my practice ever. At the time, I was struggling financially, pretty much on the brink of collapse. I had started to tell a few of the closer patients that I was probably going to be closing my doors. And the first month, having done the one-day training, it just about tripled my income. Patient numbers remained pretty much the same, but I was providing solutions that I did not have to convince anybody that they should buy. They were holding these samples saying, I want this. As a chiropractor, some of the marketing that comes our way is very much attend this seminar and Monday morning you'll transform everything. And it was true. And trust me, nobody was more surprised than I was when my first patient came in with a 20-year history of knee pain because of skiing accidents and surgery. She had begun an exercise program because she had finally gotten her husband off his butt, and he wanted to do this Power 90 something or other, which was killing her, but it was getting him to move, so she was going to stick with it. And she could not do a lunge, and she demonstrated a lunge and almost fell over, and I grabbed her and said, don't do that again. Well, this is what Marc says works, and I saw him do it, so it can't be that hard. So it took about 10 minutes. Well, no offense. Maybe I can do it, is what I meant to say. But it took about 10 minutes of, poking holes in her field, which previously was like, I don't know if I can do that, but, and some muscle testing, which I had already done. But we got the right combination of tubes in her hand, and she went down in a lunge and came back up, and her jaw dropped, and so did mine, because I'm like, wow, this stuff really does work. And she did it a few more times to prove it to herself, and then we took one of those samples away, and she went down and did not come back up, and I said, here, take that back. And then she did it again, and she was pretty excited, and so was I. And again, she's holding, about a couple $100 worth of solutions in her hand, and I'm like, oh boy, here comes the sales pitch. No. She tells me, I want this. I want this now. Can I take do you know how many times I've heard people say, can I take these with me until you get everything? And it's been transformational for me because, like so many other people out here, we want to help, and we feel bad that we have to charge money for it. I don't have to convince anybody to do this. Another milestone was another woman who I had seen along with the rest of her family. She's the grandmother. She came in for neck pain. I'm an upper cervical practitioner, so I do neck pain. So I adjust her, and not too much changes. She comes back in a week or so, and it still hurts. And so I look a little deeper, and I'm finding parasites. So we treat that, no change. She goes to another chiropractor in the area. He's been there 30 years. He's got the biggest practice. I respect his opinion very much and what he does. Not that I'd ever say it to his face, but we have a very good relationship. So she said she was going out there. I said, absolutely, go for it. He said the same thing. He adjusted her and treated her for parasites, no change. She goes up north to Coeur d'Alene to another practitioner who's been in the business for 24 years, very well respected. Again, somebody I know, and he's worked on me, I've worked on him. He adjusts her, parasites, no change. A year later, she comes back to my office, and I'm thinking, what in the world am I going to do for you now if you've just seen these two guys and they can't help you? But having been through Marc's training, a few more things were on my radar. I didn't really have to expand my repertoire all that much, but just looking at things a little differently Within about 20 minutes, she's holding a series of samples in her hand, and she's got full range of motion in her neck. The lymph nodes, which were previously visible, are no longer even palpable. Her husband's jaw is on the floor. He's like, we're buying that. I don't care what. And once again, I didn't have to sell anything to anybody. They're telling me we're taking this. She said that the pain was gone for about 4 hours just from holding those samples. Yeah, I was like, really? This stuff really? I'm doing this? Are you kidding me? She went for a walk that day. She played with her grandchildren, something she hasn't done for months. Prior to that, getting out of bed and going to the chair was it. That was a Herculean effort on her part. And after holding those samples, she's moving. When the samples finally came, or the remedies finally came in, we got her started, and I did a couple phone messages back and forth to see how she was doing. At the 2-month mark, I said, come on back in so we can reevaluate, and she told me, I just went on a 15-mile bike ride. This is somebody who couldn't even make it out of the chair pretty much throughout the day. This has been absolutely radically transformational for my practice, and if I can do it, anybody can do it, which is what I meant to say earlier. Thank you very much. And I am extremely grateful that Marc is now making this material available to all of us. So, thank you.